Hello, my name is Dr. Julie Norstrand and I'm an elder care consultant, and I focus on helping the caregiver become as effective caregiver as possible. In other words, I help them to plan ahead for the needed skills and knowledge required for caregiving. Unfortunately, over the years, when I've been working with families who are faced with caregiving responsibilities, I've come to realize that people generally enter a caregiving role with no or little planning. The problem with the lack of planning is that the caregiving experience becomes so much more stressful, and the caregiver may suffer physically, mentally, socially, and economically. And you may well have already read up on this when reading about caregiving on the internet. So what I'm going to be talking to you about today is based on the advice that I've given to my own clients over the years regarding what you can do to help yourself as you take on more and more responsibilities as a caregiver. Now, before I start, I just want to say a few words about myself in terms of my own caregiving experience. I experienced the challenges of caregiving through seeing what my parents went through with their own parents, and then much later with my own mom's end-of-life care. And my mom, she passed away just over 10 years ago. And these were experiences that made me realize the immense impact that caregiving has, not just on the individual, but the whole family. And of course, since then, I have gained so much more insight into the caregiving experience through friends, colleagues, and especially my clients. So it's something that truly impacts all of us in some way. So what I'm going to be talking about is, firstly, how to evaluate the situation. In other words, when is the optimal time to step in? Then I'll talk about the ongoing conversation and what it should consist of. Then setting up the plan collaboratively, meaning with the person that you want to provide the help to, as well as ideally other family members. I'll talk a little bit about the services and resources that you should be aware of. Then I'm going to talk about paying for long-term care. This is certainly something that I'm asked about frequently. And then as we end, I'll talk about caregivers, the work-life balance, and then the final few slides will be a little bit how to help you get started. So what I've found when working with families is that often they will ask, when is it appropriate to step in and offer help to a loved one? Well, of course, there is no simple answer to this, as each case is always so unique. But in general, I've found that the following to be good guidelines for families. So as you see here on this slide, the initial subtle signs might include, for example, forgetfulness, which is not just based on a bad night's sleep. Maybe you'll see greater confusion about routine activities. Difficulty managing finances is something I've quite often heard. That your loved one is showing signs of unsteadiness and therefore at a risk for falling. Maybe a loss or a diminished level of interest in the routine that they have often cherished. And then I would say probably the thing that a lot of people will tell me is, I'm just sensing that my loved one is having a hard time maintaining the property. Now, as time goes on, these signs can certainly become much more life-threatening. For example, food burnt on the stove, dents or scratches on a car, a pretty sudden change in weight. Often you'll see that as weight loss. You may also see a mood change, and there is typically seen in terms of a depression or anxiety. However, these can be somewhat mild. It may be hard to really get a sense of them. And then the final one, as you see here, is alcohol and medication. Now, some people may be a little surprised about that alcohol is something that you should worry about. However, as with many people, if they're becoming more isolated and lonely, they may drink a little bit more to help them get through the day, the evening. Therefore, I do think alcohol is an issue that you do need to pay attention to. Medications can be, for example, if your loved one is having a hard time figuring out when and what to take in terms of medications. I'll just tell you a little experience of my own. And this happened about 12 or 13 years ago. And it was actually with my own grandmother. She was living on her own and she wanted to stay in her own place absolutely for as long as possible. Now, unfortunately, looking back on it, there were certainly warning signs. And as I was indicating on this slide, here with the burnt food on the stove, that is exactly what happened with her. Her daughters found several times when they came and checked in on her that the food was on the stove and it was burnt. The final straw was the fact that she had a pool. It was in the wintertime. The pool had a little bit of water in it still. She fell into the pool. Luckily, a neighbor heard her calls for help and was able to help her. But ultimately, it meant that she was put into a nursing home pretty much overnight. Certainly not the scenario that we had envisioned. So this was certainly a very dramatic example of what can happen if you don't step in soon enough, but it made a huge impression on me. So my point is always, please step in before the problems arise. Another question that I'm asked about often by families is, how do I start the conversation with my parent or loved one? And of course, starting to talk about the aging process and how you're going to step in as a supportive caregiver as they become more fragile and dependent is of course never easy. It's just not a fun topic to talk about. But if you never talk about it, how are you going to learn what they want? For example, do they want to downsize? Or do they want to stay where they're currently living? Another important topic to bring up is what kind of transportation services are available in their area for when they no longer feel comfortable or are able to continue driving. Again, difficult topics to bring up, but we have to. So again, to reiterate, if you don't start the conversation, how can you start the planning? So when it comes to starting the conversation, it's important to reflect on the following key points that you see up here on this slide. Firstly, who is the best messenger? Is it you, the adult child? Or might it be someone else in the family? Maybe a friend, the primary care physician, their neighbor. And I really would encourage you to reflect a little bit on this. Because sometimes, let's say if you're going to be the adult child approaching your parent, this may not always be the right person because of the implied changes in the child-to-parent dynamic. So in other words, your parent has always been the strong one, the provider, the one who could manage the situation. And now by you coming to them, it becomes obvious that the roles are reversing. And that can certainly be a bitter pill to swallow. So again, in that scenario, if that's the sense you have, you may consider having someone completely different approach them on the initial start of this difficult conversation. Another thing to think about is, when is the best time to initiate this conversation? And often what I hear in the social media or on the news is, for example, maybe Thanksgiving or any other holiday events are the times to have these conversations. And honestly, I couldn't disagree more, as family gatherings are often very noisy, too much going on. So it's just not a conducive environment. So what you need to do instead is to find a time when the person that you want to have this conversation with is feeling alert, relaxed, and if relevant, pain-free. Sometimes mid-mornings, afternoons can work well for older adults. However, this is hopefully something that you might have a fairly good sense of. Now, of course, how do you bring something like this up? What would be a good starting phrase? This does depend on who your loved one or your parent is. And what I mean by that is it better to initiate this conversation in a very direct manner and really clearly express your own personal concerns? Or is it better to be more indirect and perhaps bring up another family where they may have discussed this topic? But ultimately, a good rule of thumb is to really please don't make these kind of statements that you must or you need to. But instead, do it in such a more open-ended questions or statements. This is much more likely to engender an ongoing conversation. And finally, I want to emphasize that please don't assume that this is just that one-time conversation. You've had the discussion and now you can walk away thinking, I've done it. No, instead, this is really something that should be considered an ongoing conversation. And the reason being is because things change constantly. Things will change inevitably for your loved one in terms of their health, maybe their thoughts, their wishes. Also, things may well change for the caregiving family, for you yourself. So again, you need to continue checking in. What I've sometimes experienced with some families is they'll say, yeah, we had the conversation and we feel we know the marching orders. And then lo and behold, a couple of weeks later, maybe a month later, it becomes very evident that there was some key misunderstanding or that the person changed their mind. And moving from the home is a key area where people often are very ambivalent about this. So please, again, assume this to be an ongoing conversation. So when helping families over the years, I aim to cover these basic areas. So on this slide here, you see health, financial and estate planning, where to live, and routine activities. But of course, each family is very unique. So some of these topics may already have been sorted out, or you may feel that there are additional key areas that are very relevant in your situation. But again, these tend to be the typical domains that I will discuss when helping families. So firstly, looking at health. I really strongly encourage you, the primary caregiver, who are going to take charge of the situation, to really be sure that you understand what's going on in terms of their health. And remember, health is a very multifaceted concept. So it's not just about their chronic physical conditions that they may have, but it's also their mental health as well as their memory. And two main points I want to make about this is, one, that you have a firm understanding of specific conditions, health conditions, that is likely to impact them going forward in the near future and potentially in the longer term future. Another important area that I really want to emphasize is that you have a sense of what medications they're taking. And sometimes this can just be a simple question of, please, could you please tell me what medications you are taking, or even better, show me the medications that you're taking. It also provides you an opportunity to make sure, can they really explain what they're taking, why they're taking it, when they're taking it. As you may recall, in the subtle signs that may cause you to be a little concerned is, or rather pretty concerned actually, is if the medications that they can't really figure out when, why, and how they need to take certain medications. But also another key point, and you'll see that on this slide here, HIPAA authorization and release form. That is, what you need to do is to ask your loved one if you could please go to a medical appointment with them. And not only does it enable you to really get a good understanding of what is going on when you see them interacting with their primary care physician or their specialist, but it also gives you an opportunity to ask to get your name on this HIPAA authorization and release form. And ultimately, by having your name on there, that enables you to get permission to get information about their health outcomes. It also enables you to be able to call the specialist or the physician if you have questions, and not having to ask your loved one for permission each time. And as you can imagine, if that your loved one should become unconscious, they may have an accident, a fall, they're in the hospital, they can't speak for themselves, then of course you're really going to want to be able to have a direct communication with their team of specialists. So again, please consider getting your name on the HIPAA authorization and release form. The other huge area is finances and estate planning. And this really needs to be tackled proactively. And in order to get a good sense of their financial situation, it really is important that you have a sense of what their assets and liabilities are. And the reason why you should really get a good overview of this is because ultimately it gives you a sense of their financial situation and therefore what kind of services that they will be able to afford in their older years. Also, find out if they have long-term care insurance or life insurance. I have unfortunately heard of cases where families didn't realize this, and their loved one was in the hospital, then transferred to rehab, and there was a lack in payment of this insurance, and therefore it fell apart and they lost their insurance because the family didn't know that they had to keep paying into it. In terms of estate planning, I am not an estate planner, I'm not an elder law attorney. However, I do want to just give you a very simplified overview to give you sort of a sort of checklist in terms of what you really need to make sure that you have addressed. And again, this is something that you should speak to about with an elder law attorney. But to simplify things in terms of estate planning, I like to look at it in terms of documentation related to the assets, and then documentation related to their health. Now, when you look at the documentation in terms of the assets, you have something called the power of attorney. This is the individual who's appointed to make decisions about the assets, or rather to follow the requests that your loved one has dictated. The last will and testament is a legal document that basically describes what's going to happen with the assets. And again, that's something that the power of attorney is going to follow. The power of attorney will follow the requests put in the last will and testament. It is important to get this set up because you really want to make the transition once the person passes away. You want to make sure that this transition in terms of inheritance happens as smoothly as possible, and that there's less likelihood of arguments and disagreements amongst the beneficiaries. Just one quick point that I want to point out is once the person who is the holder of the last will and testament dies, then the power of attorney then automatically becomes the executor. Often it's the same person who's the executor as is the power of attorney. In terms of health, you have something called the healthcare proxy. And this is the individual who's appointed to make medical decisions on behalf of the individual should they become unconscious or unable to make decisions for themselves. Now, of course, these decisions I'm referring to should be what that the loved one has indicated that they want happen to them. And that's an important point because sometimes I think, unfortunately, people who take on the role as a healthcare proxy may not always feel 100% comfortable in terms of what the wishes are of their loved one. If you don't feel comfortable in the requests that the loved one may have indicated, you should not take on this role. For example, some people don't agree with the idea of cremation. And if your loved one wants to be cremated, but you yourself don't feel comfortable with it, you're going to have a hard time following through on their wishes. But ultimately, the critical point is that the healthcare proxy follows through on, does the person, have they indicated that they do want life-saving treatments or not? What kind of medication they may request? And as I indicated a moment ago, in terms of what kind of burial that they want, and any other special instructions or wishes. It's important to note that the healthcare proxy loses their power if the individual gains consciousness and can speak for themselves. So ultimately, the healthcare proxy only has this responsibility if the individual is unconscious. A living will is created at the same time as the healthcare proxy and is the document that specifies the specific wishes that the individual has around life-prolonging treatments in the event of a terminal illness. In Massachusetts, you have something called the MOLST, Massachusetts Medical Orders of Scope of Treatment. And this is a document that I definitely also recommend that you make sure your loved one looks into. It's set up with their doctor, and it's typically done at the point when the loved one is experiencing terminal illness or it is pretty evident that they don't have much longer to live. Then the question of what kind of life-sustaining treatments do they really want is very necessary. The MOLST is a pink form. Often families know that they should put it up on their fridge door. So if in the case of an emergency, the ambulance people arrive, they'll go straight to the fridge door so they have a sense of what the requests are. Because they very well know that the MOLST is this very brightly colored pink form. Another one, which I think is a great one, is something called the 5 Wishes. And this is an online website. And it's a really excellent way to help families get this conversation started around end-of-life care. And it puts this conversation into a much more sort of everyday language, which helps people to express their wishes in many areas, not only the medical and the legal, but also the more personal and spiritual. But ultimately, again, I want to emphasize, I cannot stress enough, please make sure that you get your financial and estate planning, that you know that your loved one has done it, and that you as the potential caregiver know where these documents are, what the wishes are, and who has what responsibilities, meaning specifically who's the power of attorney, who's the healthcare proxy. One thing I just quickly want to point out, and that is in terms of estate planning regarding the assets, and that is for families who may have more notable assets, or rather that they have They're in a situation where the distribution of the assets is a little bit more complicated, and this can be something that happens in divorced families. Then it is very important to set up a trust. And the trust also gives you privacy. In other words, that you can avoid probate by setting up a trust. And just very quickly, I'll just point out to you that there are two types of trusts. There is the irrevocable trust, and this is something which people will set up if they want to protect their assets from the costs of long-term care. I can talk about that in a little bit later when I talk about how to pay for long-term care. Another type of trust is the revocable trust. This doesn't protect you from long-term care costs, but it does minimize federal and Massachusetts estate taxes. So moving on, and here I want to address where to live. And this is another incredibly important area. People have very strong feelings about where they want to live. And the research really shows that the vast majority of older adults, people from age 50 and over, about 9 out of 10 people will indicate that they want to stay living in their own homes for absolutely as long as possible. And this is a term that we call aging in place. And it's certainly very understandable that people want to stay where they live because they know their own, they know their home, they got memories from there, they know their community. But in order for this to work, it's really important that you ensure that the home in which they're currently living and want to continue living in is made as safe and as comfortable as possible. And there are many things that you can do to modify the home in order to make it more suitable for an older person. And that can include, for example, adding non-slip strips in the bathtub and shower, applying non-slip wax on floors, putting non-skid treads on steps, removing throw rugs, lowering things in the kitchen so that they're less likely to fall on them as they're reaching for them, replacing standard doorknobs with lever handles, and replacing a low toilet seat to a much higher raised toilet seat. Many of you may have heard of AARP. This is a fantastic website, and they provide lots of great information about what you can do to make your home safer. And indeed, the National Association of Home Builders and AARP have developed something called the Certified Aging in Place Specialist Program. And that is something that I would definitely recommend for you to look into if you're considering what kind of modifications might you consider for the home of your loved one. If, let's say, that continuing to live in their own home isn't the optimal choice, then you could possibly consider that your loved one would move in with you. However, I will say that for many families, this is not an ideal scenario. Often the size of the home of the adult child is not big enough, or it's just a poor setup. There may also be family dynamics that doesn't make this the ideal scenario, and also from the perspective of the older person, they may not always want to be living with their children. So instead, some older adults may opt for senior housing or subsidized housing as a way of minimizing costs. And then, of course, we have the options of long-term care, senior residential living. And this ranges all the way from independent living to assisted living, memory care, as well as nursing home. And I will be talking about these in a little while as well. The last thing I would like for people to consider is to have an understanding of what your loved one's routine is like. And the reason why this is relevant is because it'll give you a sense of where to start in terms of possibly stepping in to provide some help. And often a key area to assess is whether they can or should continue to drive. And the reason why this is so important is because if and when they're no longer able to drive, this can prevent them from continuing to do the routine activities. And ultimately, they can become isolated and lonely, especially if they're living all on their own. So in order to prevent this, you should really start to look at what public transportation options are available so that you can ensure that they can continue doing the things that make up their routine. And it's not necessarily just the things including going to their healthcare provider or getting the food that they need, but also going to the places that they love to hang out with their friends, or maybe going to their favorite restaurants. We all know that our routine is what makes us who we are, and you really want to sustain that sense of identity with your older loved one. But again, throughout this conversation where you're covering these main points, is to really make sure that you're not imposing your own thoughts, beliefs, or wishes on them, but instead that you really listen to what their wishes are and try to follow it as much as possible. So as you're starting to learn about your loved one's situation and getting a sense of where help may be needed or where changes need to be made, it's important to not go it alone. Ultimately, you should try to collaborate with your parents or your loved one, as well as other family members or anyone else who may become part of this care team. And often these other family members are your siblings. But again, as I said, you can try to be creative. Sometimes it can be the neighbors, sometimes it can be the really good friend that also takes on a role in setting up this plan. But ultimately, it's so important that when you are developing this plan, that you try not to take the lead, but that you let your loved one take the lead as much as possible. And what I've found helpful for families when they are working on a future care plan is to start to think about who is good at what. So ultimately what I'm saying is to allocate responsibilities according to personal strengths. So some people, they're good at the more practical stuff, such as making house repairs, paying bills, searching for information on the internet, while others may be more suited at the more emotional support and providing compassion. So by allocating responsibilities to people according to their strengths, I strongly believe that people are more likely to buy into being part of this plan. Trying to figure out who is good at what can sometimes require a little bit of introspection and sometimes a little bit of creativity. But again, to reiterate, it is so important that you try as much when you're setting up this plan that you try to promote their sense of autonomy, their sense of independence, and that you really promote a sense of dignity. Another area that's super critical to become knowledgeable about is the kinds of services and resources available for older adults in your community. I find that people are often surprised at how much is actually available. And what I'm referring to is the Aging Network. This was established by the Older Americans Act in 1965, and it's a national network of federal, state, and local agencies whose mission is all about helping to plan and provide services so that older adults, and in actual fact people of all ages with disabilities, can age and live independently in their own homes and communities for as long as possible. And the Aging Network is found throughout the United States, in all 50 states. And when focusing more on services for older adults, generally the cutoff is 60 years and older, but there is certainly some variability in that. Now, this is a very busy slide, but the main thing that I want you to take from this slide is to get a sense of the vast array of services that you can reach out to and inquire about through the Aging Network. So you have various types of access to services, nutrition programs, home community-based long-term care services and supports, disease prevention and health promotion, and then also if you have concerns about the vulnerable elder rights protection. When you think about the Aging Network, you can think of it as small as your local senior center or your council on aging. You can think of it in a larger capacity as an aging service access point. Minuteman is one that covers the Littleton city area. But please, when you get a chance, go to, for example, the Minuteman service website and just take a look at the different array of services that they provide. And I think you'll be quite amazed by how much is available. One caveat though is, yes, they're excellent in the sense of reaching out, getting information. The caveat though is that if you need a service, for example, a home health aid sent to the home of your loved one, the wait time can be quite long. And therefore some people, especially if they're in an emergency situation, will go to private agencies which are more expensive than the services provided through the Aging Network. But at least start finding out as much information as you can now, so that at least when you need the help, you can at least put your name in for getting this service, and then it may take weeks, it may take more than that to get the service in your home. And in the meantime, as I said, you may have to rely on more expensive private agencies. For getting a sense of what's available in your specific area, you can look up a website called the Elder Care Locator. This is an excellent website that gives you put in your zip code and it'll give you different Aging Network resources that are available right in your area. The other thing to know about is Benefits Checkup, another website to go to. And this is especially important for families that are financially struggling. And there you can see whether your loved one may be eligible for assistance. For example, it can connect struggling seniors to programs about how to afford food, utilities, medications, and more. So definitely also look up Benefits Checkup. As I mentioned earlier, I was going to talk about how to pay for long-term care. Unfortunately, I have come across many families where they were under the assumption that Medicare was going to pay for long-term care services. That is not the case. Medicare does cover nursing home costs when requiring skilled nursing or rehabilitation services. However, there's a limit to that time frame of up to 100 days, and thereafter you're on your own in terms of paying for this. But just in terms of supporting an older one living in their own home, in terms of general activities of daily living, i.e. more non-medical support, their Medicare does not cover for that. On this page here, you see three main ways to think about how you might pay for long-term care. You've got personal funds, government programs, and then private financing options. Firstly, personal funds is ultimately what it is paying out of pocket. And this is typically the scenario is where you have the adult child or individuals who step in as the caregivers, and they're doing this in order to save as much money as possible. However, you should realize as that caregiver who is stepping in and maybe living with your parent to provide much greater support, that inevitably you will probably be paying some money out of pocket. A study back in 2021 found that people paid, on average, they paid about a quarter of their income on caregiver expenses. And these expenses were typically paying for their loved one's rent or mortgage, maybe home modifications, medical payments, and so on. The unpaid care, as in the family caregiver who is providing the care, is a very unseen part of our population. They really are the backbone of senior care. Again, referring back to a study from 2021, they estimated that if you were to add up the costs of all those people who provide unpaid care, it would be equivalent to about $600 billion. So again, it really makes you realize the enormous amount of care that they provide, and they're doing it unpaid. Another area to look into is through services that you might be able to get through government programs. And as you can see here on this slide, there are quite a few: Medicare, Medicaid, PACE, Department of Veterans Affairs, Social Security Administration programs. I'm not going to talk about all of them. The ones that I get asked about typically are, how can I get my loved one to get on Medicaid, so that because Medicaid will pay for long-term care. There is a 5-year look back. So if you are going to set up a trust, which is what I talked about, you would be setting up an irrevocable trust 5 years prior to your loved one needing long-term care. That is what some people are doing. It is important to realize that the options when it comes to nursing home, let's say, with under Medicaid, may not always be the most desirable settings. So I always feel that think twice about getting your loved one on Medicaid. However, I fully understand that families really want to protect their assets and do not want to see them burned away through paying for long-term care. PACE is another program, and I will be talking about that in a little bit more detail in a later slide. But just briefly, it's important that you know about PACE. It's the Program of All-Inclusive Care for the Elderly. It's administered by both Mass Health and Medicare. And so if you're eligible for both, then it enables you to be able to get nursing home care within your own home. So ultimately you have to be income eligible, and you also have to be eligible for being going into a nursing home. But it is an absolutely wonderful program because it really provides a whole host of services, from medical, social, recreational, and wellness services, and it enables you to stay within your own home as long as possible. But the one caveat as well is the fact that you have to live in an area which is covered by PACE, and it's not all areas that is covered by PACE here in Massachusetts, and it's not all states that have PACE as a program. But here in the Littleton area, you should definitely be looking into it if you think this is something that might be suitable. And then finally, the private financing options. I mentioned trusts, there's long-term care insurance. This is something that a lot of people are asking about. Typically, long-term care insurance is ideal for people to sign up for if they're in their 50s, 60s, and 70s. At that point, the earlier you start, the less the premium will be. Some people feel that the cost for the premium is just too much and they can't afford long-term care. But it's certainly something that there is a peace of mind for many people who have long-term care insurance. I do realize this is a very quick overview, but at least I wanted to give you a sense of the different potential payment options when it comes to looking at long-term care. Now, if you are someone who is working, it is really important that you have a sense of what you might be able to expect from your employer. And before I do that, I just want to give you a quick snapshot overview of what employee caregivers typically look like. And this is data from 2020. And back then, there were approximately 53 million caregivers in our country, caring for either a child with special needs or for an adult. And this represented about 1 in 5 adults being caregivers in the US. So that's a pretty significant number. And the majority of these people were also holding jobs. About 61% of caregivers also have a job, even though the time spent caring averages roughly about 20 hours per week. So it doesn't take a rocket science to figure out the work-life balance, how that can be such a hard one for many people. So it shouldn't come as a surprise that for many caregivers who are working, they may feel that the only alternative for them is to simply exit the workforce. And this is something that I always try to make sure that people really know what they may be doing to themselves by doing that. In other words, typically people will exit the workforce once they start caring, which is around 50 years of age. And if they leave, let's say, at the early phases of caregiving, they could stand to lose, on average, about $522,000 in income and benefits over their lifetime. So that really clearly indicates the enormous economic downside it can have on the caregiver who exits the workforce prematurely. So instead, what I would encourage you to do is to really figure out what may your employer have that can support you as a caregiver. There is the Family Medical Leave Act, and that's something that you should know. Not all employers have it, so find out if yours does. The other thing to find out from your employer is whether they have an employer assistance program. And this is a voluntary work-based program that provides often free or very low cost confidential assessments, short-term counseling, referrals, and follow-up services to any employee that requests this type of help. And then finally, the ERGs, and that's the employer resource groups. And these are run by the employees themselves, and it's employees who have basically banded together, decided what key areas are important to them. Some of them focus on childcare, some of them focus on mental health, some of them focus on elder care. Again, find out if your workplace does have an ERG and whether they can maybe be a resource to you. So here These last final slides are meant to help get you started in this process of setting up a care plan. This first one here gives you the terminology of some of the domains that I have discussed throughout. And I find that the reason why I developed this is because I find clearly for people who are completely new to the aging field, they don't know the terms for different services. So this should hopefully help you out. This slide here gives you what you will need when you're investigating for a loved one who is still considered independent and who does not need help with more basic functional activities such as bathing or eating. And on this slide here, you'll see a 1-800 number. This is an 800 number that obviously works throughout the states. And it's an excellent way, if you're a little unsure what's the question? I'm a little confused. I don't even know what I'm supposed to be asking for. This is a wonderful counseling service that they really have heard so many families, and they can really guide you to what may be the best department or agency for you to reach out to. For example, some people have no idea about the nutrition programs, but they're worried about their loved one living at home alone and they're not feeding themselves sufficiently. Then you can call up this number and find they would tell you about the Meals on Wheels program. So again, for people who have no knowledge of this, this can be tremendous. The very last one here is, you'll see what it's called the Genworth Cost of Care Survey. Take a look at this survey, just look it up on the internet. And it gives you a sense of the cost of various types of long-term care options in your area. So you'll be putting in the name of the town, maybe your zip code, and it'll give you the cost by month or by year in terms of what the cost is for a home health aide, what the cost is for an assisted living, what the cost for a nursing home. I will, though, say that you should probably have a stiff drink before you take a look at this website, because it is quite shocking how expensive long-term care can be. This last slide here is for when your loved one is more frail and needs higher level of care. Often at this point, it can be quite challenging to provide the care, especially if you're still working and you're taking care of your own immediate family. The question you'll want to ask yourself is, does your loved one want to remain in their own home for as long as possible? Or are they willing to possibly move into some type of facility such as assisted or maybe nursing home? If you're looking for options that pertain to the older adult wanting to remain in their own home for as long as possible, then please look at the options that support you in the community. And what I'm referring to here is the home and community-based services. And just as an example, this may include home care, home health aides, transportation to medical care, personal care, respite care, hospice, case management. There is a whole array of services that you can get right within your community. I talked about the Medicaid supported program PACE. Here you see the specific requirements. You have to be 55 and older. You have to live in an area that does support a PACE program. You have to be needing nursing home level care. And you also have to be able to live safely at home with the nursing home, with the PACE program care. And as far as I'm aware, currently it's available in 32 out of the 50 states. If instead you're looking at a care facility, in other words, having your loved one move into some sort of residential facility. You have, as you see here on this slide, you can go to the two websites, the NIA website and the AARP websites have lots of excellent information about the types of residential options that may be open to your loved one. And as I mentioned earlier, they range from independent living through to assisted living, nursing home, memory care facilities. There is something called the continuing care retirement communities. These are wonderful, very expensive, but they are wonderful. And one of the advantages that they have is that you can stay pretty much in place and get all the different levels of care depending on what you need at that point in time. So instead of having to, let's say, move from independent living over to a completely different site to get assisted living, with continuing care retirement communities, you would not need to do that. But again, as I said, they are quite expensive. I did actually visit one about 10 years ago, and I remember telling my husband after the visit, I think I could move in right now. But I certainly didn't need to, and I wouldn't have been able to because of the cost. But it was quite wonderful. Overall, what I find is that people's decisions on which direction to go, whether community-based care or care in a facility, is often determined by three factors. The first one is whether your loved one wants to remain in their own home for as long as possible or not, if they're willing to move. Second, safety and level of frailty. So maybe living at home, even though it is their wish, is just not feasible anymore. And then, of course, cost, meaning that moving into a care facility is obviously much more expensive than providing care in the home. However, there is a fine balance, because if you're looking at a scenario where your loved one needs 24-hour care, then in actual fact, moving into an assisted living or even nursing home can be cheaper, because the one-on-one 24-hour care at home obviously does become very expensive. But again, these are some factors that often people will think about when trying to navigate what may be their best options. I have provided you with a lot of information in a very short amount of time, but I do hope that once you get a chance to review the video, that it will give you a chance to really start to reflect on some of the things I've said, help you start the conversation, know what kind of things to be looking out for, what things to cover, and what are your options in the long run. But ultimately, I want to emphasize that you ideally need to be very proactive, and you need to start the conversation as soon as possible. Thank you.